It's possible I have the most extensive oral care of anyone on planet Earth. Today I'm going to share what I do and what you can do at home to get your oral health in tip-top shape. And I'll tell
Hello everyone, I'm Dr. Mo and I'm a licensed dentist. We will be critiquing this vampire, or I'm kidding, Bryan Johnson's living to age 1000 oral healthcare routine.
Tell you that I didn't start in a good place. My teeth were literally rotting. I was losing attachment on my gums. My teeth were not in a good place. I had a lot of sugar in my diet. The situation was not good. And you probably relate to this, that you maybe look at the teeth in the mirror and you're not quite sure, do you fully look or do you kind of close the mouth and wish for the best? You don't know if you go to the dentist, if they're going to do some big construction or they're going to have to repair a whole bunch of cavities. It's a really anxiety-inducing topic.
Yeah, I would definitely argue that the dentist visit is one of the most anxiety-inducing and type of visits that patients may be reluctant to have. That being said, I would highly encourage people to visit a dentist at least for a checkup each 6 months.
Now, as with all things Blueprint, you want to take baseline measurements. I know when I've gone into the dentist previously, you go there, they do a cleaning, the dentist will come in, they'll give you a look over and say, no cavities, great, you're good to go. But oftentimes that misses some of the more important elements. So for me, we said we want to look at pocket depth, which is you take from the top of the gum to the bottom of the pocket, and you want to see how deep that is. If it's 1 to 3 millimeters, you're in good shape. If it's 4 or 5, it needs some work. The second is attachment.
So before we get to attachment loss, a pocket depth is that pocket, gingival pocket that he mentioned. And he's using something that's called as a periodontal probe. That is the instrument that they use to measure the pocket. If the pocket depth is, as he mentioned, 1 to 3 millimeter, then that is generally within reason. If it's extending to 4 or 5, we need to see what's wrong. Why is it that extensive? Now we get to attachment loss.
Attachment, where you want to see the firmness around the tooth. Third is you want to see.
So attachment loss is addressing the attachment between the complex of your gums, that pinkish area that we saw, and with the bone and the fibers, etc., and your tooth. The more significant the attachment loss, the more tooth mobility that you're going to have.
The plaque index, the hardened plaque around the tooth, and then you also want to measure how easy or hard it is for your gums to bleed. Now, once you have those baseline measurements,
so gum bleeding and plaque index,
there's a rough
extensive pocket depth, attachment loss, these are all signs of periodontal disease, and there are also ways that are used and to measure and diagnose any periodontal problems that you may have. For those that don't know what periodontal means, so when we talk about periodontics, it's the science addressing this complex. So your gums, the bone, the attachment fibers. So whenever we say periodontal disease or periodontal problem, we're talking about predominantly that complex. A periodontist is a person who's like a gum specialist. He checks on, he takes care of that section.
Idea where your oral health is at. The first thing I do in my protocol is I use a water pick. These can cost anywhere from $40 to $200, but you see it's a high pressure stream of water that comes out like a hose, and you run it along the gum line around your entire teeth. If you brush and floss and then you use your water pick, you're still gonna see stuff come out. And so it really is effective in getting your mouth really clean. I do this for the first step. Now, after water.
So notice something extremely important here. Normally people, when talking about the different types of a dental floss, they're saying, oh, should you use like a toothpick or a string floss, which is like a string one, or should you use a water flosser? But Bryan Johnson here addresses that he uses both. He uses the string floss and the water floss. Now, I've read a lot of studies in relation to string floss and water floss, so there's some mixed opinion, but the more water flosses are getting more technologically advanced and more effective. I mean, I've seen some studies showing really comparative results between the traditional string floss and the most advanced water flossers. So water floss is becoming really good, but he says to be the safe side, he uses both. Nothing wrong with using both. I'm also a huge advocate of water flossers. He mentions Waterpick as the product. A lot of people, when they go to choose, they're like, okay, what should we pick? So actually there's something called as the American Dental Association, and the American Dental Association checks on products, and if a product meets a certain criteria, they give them the ADA seal, the American Dental Association seal. Waterpick, to my knowledge, has that seal. Now you could go to the official ADA website and find which products are given that seal. Now it doesn't mean that only these products are good and effective. Just do your own research.
Picking, flossing is number 2. I use this Dr. Tongues. It has a more thicker string. I think in the studies we evaluated, it showed a 25% increase in the amount of plaque it could pick up from the smaller strands. I used to use Oral-B, now it's Dr. Tongues.
So to be completely honest with you, I did research about this to audit this claim that a thicker floss is, whatever he mentions, a very specific percentage. He says 25% more effective than a thin floss. The way I would look at it from an evidence-based approach is that they are different sizes for a reason. So they're different sizes because some people, we have the arrangement of our teeth, right? So some people, they have their teeth really tight adjacent to each other. So how is a thick floss going to enter? It's going to be extremely difficult and challenging. So they may use a thinner floss to be more efficient, granted they use it correctly. Now, let's say somebody has some gap between his teeth next to each other. So is it reasonable or logical, even evidence-based, for him to use a thin floss? It does not make any sense. So he should use a thicker floss in order to clean that gap that's present. He just has more space between his teeth.
I use both a Waterpick and floss because they're each good and helpful at picking up debris at various parts of the gum and teeth. Third step is I use an electric toothbrush. Now I prefer...
Just one last note about the water... about the water floss. It could be for patients who have an orthodontics, meaning braces, orthodontic treatment being done. Water flosser is extremely helpful for them. We also have a different form of a brush, and that is called the interdental brush. You could research it also for patients with braces because they struggle to clean their teeth, and also they're more susceptible to having plaque and debris accumulating on them.
The electric because I find it cleans my teeth better, but you may prefer a manual, and that's just fine. Find the one that's right for you. Now with my electric toothbrush, I prefer soft bristles versus hard because I find that it can clean just as well without the harsh friction. And then there's small things you can do. For example, you can wait 30 minutes after eating because your teeth enamel get a little soft after eating. So waiting 30 minutes before you brush can be helpful.
So there's just few things to address there, and I'll start with the soft versus hard bristles. And this upsets a lot of people, the viewers also and followers of mine. So they're like, they make claims such as, oh, we used, hard bristles all my life and everything is fine. So keep in mind, the tissues, the oral tissues inside your mouth, your gums, etc., they're very delicate. And according to the ADA, the American Dental Association, their recommendation is to brush using soft bristle. So your gums are delicate. Why would you go for a hard, harsh one when there's just lack of evidence as to is it even cleaning more effectively? You have the ADA recommendation to help you. Also, he mentioned about electric versus manual. So where I would say the electric toothbrush has an advantage if there's people who have problems with manual dexterity, meaning they're having issues, right, like Parkinson's patient and other patients who are handicapped or may have some issues in properly using the traditional manual toothbrush. Otherwise, the manual toothbrush is really effective as well. Other than this, he talked about like 30 minutes, waiting 30 minutes after eating to brush. So there's why is it 30 minutes? So there's actually something called as the Stephen curve, and it sort of measures over time the like how does the pH of your teeth being affected by the food that are like entered. Let's say you had a food with citrus, or let's say you had an orange, or you ate food where it had lemon or whatever. Okay, so following eating something acidic, is there, even if you had coffee, he would wait 30 minutes, because there's a curve where at the beginning your teeth are like at the worst pH for you to clean, or use like an abrasive tool like a toothbrush or so forth with it, and just wait some time for the pH to sort of normalize again. And I will show the curve. It's called stiffen curve. So I agree with this, for you to wait a while and then brush your teeth.
As for my toothpaste, I currently am using two. I use one in the morning, one at night. There's no reason why. I just think it's fun to change toothpaste. Also, I try to get every single bit out of the tube, because you know what? Why waste anything? These pass because they don't have fluoride. They help whiten.
There's a whole anti-fluoride movement, and I have really researched in depth about this. Guys and girls, you need to either misuse or swallow or have an allergy to fluoride. It's very minuscule, extremely small percentage of people. Like you really need to use fluoride in a wrong way for you to have some adverse effects that people are mentioning all over TikTok and over the internet. So I'm not with the anti-fluoride movement. Fluoride itself, based on scientific evidence, has a lot of benefits. It helps reduce your teeth susceptibility to caries, so for preventable purposes. And just people are fighting with fluoride when you can use it.
And they don't have other junk. Step number 4 is a tongue scraper. Why didn't anybody tell me about this? These are really important. So the tongue gets kind of dirty, just like the teeth do, and it needs a cleaning just like the teeth do. And so this tongue scraper, stick out your tongue, scrape it, do it a few times, and you will notice a very big difference in oral health. If this is not a practice you do today, I would encourage you to start it. It will be a game changer. Now for mouthwash,
ADA recommendation in relation to the tongue scrapers, and the rationale was your tongue needs to be cleaned, and you could do this cleaning with a toothbrush that you regularly use, or if you may, you can use a tongue scraper. However, it like a toothbrush will do the job. Okay, but your tongue needs to be clean. You must clean your now we will talk about mouthwashes.
I've used this guy. It has xylitol. And I only use it in 2 circumstances. One is when I'm about to be in close contact with others to avoid having bad breath. We all know what it's like to talk to somebody with bad breath. And then secondarily is if you're about to smooch and you want to be freshened up, give your partner the very best. Next is bruxism. This one's near and dear to
So I'm just going to give you this summary in relation to mouthwashes, mouth rinses, etc. It is a good to have. It's not necessary, okay? That being said, there are certain individuals, i.e. patients, who are prescribed by their dentist, by their healthcare professional, a mouthwash for specific reasons, for a specific issue that they have, right? That's mostly in relation to periodontal problem or so forth. That being said, the mouthwash or mouth rinse does not replace your toothbrush and dental floss. Okay, so it's a good to have. I don't see it as an absolute necessity. You could have your brushing and flossing and cleaning your tongue should be enough.
My heart. For 20 years, I was grinding my teeth at night. So I'd go to bed, I'd wake up, and I would catch myself grinding my teeth. It was a really unpleasant sound and feeling, and I couldn't stop myself. I'd try to meditate and relax, but I just couldn't stop it. Now, if you have bruxism or you think you may have bruxism, I'm going to strongly encourage you to try to address it. The dentist I spoke with would recommend a mouth guard of some variety. Sometimes it was hard, sometimes it was soft. I would grind my way through those. It didn't stop my grinding, it just created a cushion for my teeth, but it still created the wear and tear. When you're grinding, it not only just creates wear and tear on the teeth, but also increases pocket depth, it increases attachment loss, it just ages your entire mouth. And so I didn't fix it until a dentist recently on Blueprint recommended this one, which is Somno Dent Device. And what it does, it's a top and a bottom layer, and it arrests your mouth. When you first put it in, you feel claustrophobic because it just, you can't move at all. Over time, it becomes very soothing. And so for the first time in my life, it's been able to arrest my bruxism, and it has stopped the decay of my teeth quality.
So I'm
And then of course,
sure about the stopping of tooth decay quality claim, but other than this, I would say definitely bruxism, must address it as soon as possible with your dentist. It is a serious issue. You could have your teeth literally breaking because of bruxism as it advances. It may also cause you have a joint here called temporomandibular joint. You could have some pains and problems, orders in relation to the joint because of bruxism. So your teeth could be breaking, and it can cause a lot of definitely complication issues for you. Definitely the night guard is a good way to alleviate some of that stress when you put it between your teeth. That being said, a very important note is that you should address the root cause of the bruxism. Why is your bruxism why is it happening? What is the reason? What is the root cause behind it? Because the night guard will alleviate the symptoms, however it does not address the root cause of the bruxism.
We all know this, it's wise to visit the dentist every 6 months or so to get a teeth cleaning, remove the stains, and get an assessment on how we're doing with our oral health. You may guess I have done some out of the normal things for my oral health. If you're interested in these more advanced therapies to try and correct challenges you have, they are on my website, protocol.bryanjohnson.com, and you can take them to your dentist and see if they will do them for you. My markers have dramatically improved. My attachment loss is 41% better, and my dentist reports that my gums are as healthy as a teenager. Now for basic life decision making on a day-to-day basis, there are 3 simple ones to follow. 1 is avoid sugar. It's bad for the teeth. 2 is be
sugar. It's like the fuel that your bacteria consumes in the mouth, in the oral cavity, and then the waste is like that acid that sort of gradually breaks down your teeth. Then they form that cavity or that house for these bacteria to enjoy their holiday.
Be mindful that some people's teeth can be sensitive to acidic liquids, for example, sipping on lemon water or caffeine, and so exposing your teeth all day long to that can be bad. And 3 is assess for dry mouth condition. Saliva really helps maintain the proper balance in the mouth.
So critical role in a lot of things, in neutralizing the pH, in helping with chewing the food, in reducing the rate of decay and decay happening. Saliva also has minerals that helps in the remineralization of your teeth. If you have dry mouth or reduced saliva, you're more susceptible to having oral problems. Okay, so address if you have there's also patients with almost no saliva, so it's very important to address it.
Check with your dentist if you have a dry mouth condition to see if it can be addressed. So there you have it. There's a few simple things you can do. Water pick, floss, brush daily, see your dentist every 6 months, and then avoid sugar, and you're off to a great start. Powered by...
Thank you, and girls, thank you very much for watching. Dr. Mo Dentist here, and see you next time.